there's a lot of contention over whether or not addiction is a physical disease or if it's a mental, spiritual disease. If we look at programs like the 12-step program or Alcoholics Anonymous, they'll pretty well state that it's a disease and we should look at it as a disease. But if we ask a medical doctor if alcoholism or addiction is a disease, I don't think they would be able to firmly state that it is a physical disease, because with alcoholism and addiction and substance use disorder, a doctor or a surgeon can't take an instrument, can't take a scalpel and excise or remove the disease from the patient. It's not systemic. It's not something that we can pinpoint within the body and say, hey, there's the addiction, there's the alcoholism, there's a substance use disorder. But if we look at it from the lens of addiction being a dis-ease as in discontent within the individual, a psycho-social, emotional, spiritual dis-ease within the individual who is currently in active addiction or alcoholism, then it makes more sense that addiction is a dis-ease. Because when we're in addiction, we are numbing ourselves with our substance of choice, and that's usually to cover up some kind of pain that we are experiencing when sober. And when we're sober, we can't deal with the trauma, the sorrow, the grief, whatever experience may have befallen us. We can't handle it. So as addicts, as alcoholics, we go to the bottle or we go to the substance, and those are our pacifiers. It's our comfort. It's what comforts our disease and takes away that pain, even if it is temporary. It's a numbing agent, and we typically tend to numb ourselves or self-medicate ourselves. Now this is important to realize, because until we acknowledge that as addicts, as alcoholics, that we have something that we are covering up with our addiction, we're not going to be able to overcome it. When we take away the substance, the numbing agent, the alcohol, and we're sober, all the feelings are going to rise up to the surface. And if we don't have the right measures in place, the right coping mechanisms, the healthy coping mechanisms, the healthy defense mechanisms, then we're going to spiral out. We're gonna train wreck. We're gonna fall back into our old pattern of behavior, because that's what we're used to. That's what we know. That's what's comfortable. So until we develop a system and a plan and a social network that can support our recovery, we won't be successful. To recap really quickly, alcoholism and addiction and substance use disorder, it is a disease, but it's a psycho-social, emotional, spiritual dis-ease or discontent within the individual, rather than it is a medical disease like cancer or lung disease or heart disease. We can't pinpoint the disease in the body. It's not systemic. So it's rather discontent with the world or discontent with our life, whether it's repressing our trauma, our hurt, our pain, our sorrow, our grief. We're not dealing with something properly in a healthy manner, and that manifests as alcoholism or addiction, because we're numbing the pain of everyday existence. So until we realize that and get a system in place which involves other people and having other people hold us accountable and support us and guide us along the path to recovery, we're not going to be able to be successful in recovery. We need others to help us, because we can't solve a problem on the level of its creation. And if we cause the problem, we're not going to be able to solve our own problem. So if we're in addiction, active addiction, we're not going to be able to bring ourselves out of that active addiction. We're going to need help. We're going to need outside help from others who have lived similar lives, who have had lived experience, and who can guide us and bring us up out of the darkness that they may once have also been in. So if you like this video, give me a like and subscribe, and check out this one for more.